Hello, my name is Dawn Reshort-Onsele. This is a presentation for Nursing 302, Business of Healthcare. The presentation will discuss the healthcare delivery system in the United States. What is a healthcare delivery system? She and Singh describe a healthcare delivery system as a quad function model of financing, insurance, delivery, and payment mechanisms that are loosely coordinated. Healthcare delivery in the United States is unique compared to healthcare in other countries. The United States healthcare is evolving in an attempt to provide better care with improved patient outcomes. The World Health Organization stated in an article by Pina and colleagues that the goal of the health system is to promote, restore, and maintain health. The healthcare delivery system is delivered by private insurance and public insurance programs. Why is understanding the healthcare delivery system important? Understanding the healthcare delivery system is important to ensure safe, cost-effective, and quality health services are provided to the population. Understanding the healthcare delivery system also allows the monitoring of patient access to care and the quality of services provided. It also allows the monitoring of services related to disease diagnoses and treatment. Mays and colleagues state that understanding the healthcare delivery system is important to be able to improve the system. Who are the providers of healthcare? Medical doctors or doctors of osteopathic medicine, specialty doctors, nurse practitioners, physician assistants, nurses, LPNs and RNs, and pharmacists. What do the providers do? Medical doctors and doctors of osteopathic medicine provide primary care services for the prevention and treatment of acute and chronic illnesses and diseases. Specialty doctors focus on specific systems of the human body. Nurse practitioners and physician assistants work under the direction of a physician to provide care to patients. The availability of nurse practitioners and physician assistants make care more accessible to a greater number of patients. Nurses provide care to patients as ordered by physicians, nurse practitioners, and physician assistants. Pharmacists provide guidance and assistance with medication management and medication education to patients. How do these providers address or create inequity in healthcare access? Providers can cause inequity by having linguistic biases or stereotypes of racial or regional biases. An article by Lee and colleagues addresses perceptual biases with certain speech styles. A patient with a country accent can be misinterpreted by a provider to think that the patient is uneducated. This stereotype would mean every person from a rural area is uneducated. This is not true because many people from rural areas go to college and obtain degrees. The article also refers to the underrepresentation of Black Americans in the clinical workforce. Providers can also address these issues by evaluating themselves to see what type of stereotypes they have regarding their patient population and work toward correcting their assessment techniques to prevent the stereotypical behavior. Another way providers can address inequity concerning language barriers is to provide interpreters for patients who speak another language. Providers should attempt to provide excellent care to all of their patients regardless of race and socioeconomic status. Nurse practitioners and physician assistants address inequities by providing care to patients in rural areas and make healthcare more accessible. Nurses provide care to all patients. Nurses should be advocates for the patient to ensure the doctors, nurse practitioners, and physician assistants provide quality care in a way a patient can understand and be successful with their healthcare regimen. Nurses provide education to the patients and help to identify barriers to following the plan of care to manage acute and chronic illnesses and diseases. Pharmacists monitor medication regimens, looking for possible interactions between medications and polypharmacy issues, and educate patients on medications used to treat illnesses and diseases. What are the settings in which healthcare is delivered? Doctor's offices. This is where patients go to receive scheduled care and discuss disease management. Outpatient care. This is where patients go to treat acute health issues and have testing done to investigate those health issues. Short-term treatment is performed here without an overnight stay. Long-term care settings. These are nursing homes where patients go to live when they can no longer provide safe and effective care at home without assistance. Health centers. These centers can provide primary care, education opportunities, and health screenings for the underserved populations. These facilities serve the poor, racial and ethnic minorities, homeless, and migrant populations. How does the healthcare setting address inequities in healthcare delivery? All of the mentioned healthcare settings improve inequity by providing patient-centered care. Pina and colleagues stated that healthcare settings once followed a provider and payment-centered care model, but have recently moved to a patient-centered care model. This approach focuses on respect for patient values, patient preference of care, integration of care, sharing of information between patient and provider, improved communication, education of patients, emotional support, involvement of patient and family in care planning, and continuity of care between providers. Outpatient care centers address inequity by providing a more cost-effective way for patients to receive care. Years ago, patients would have to spend nights in the hospital to have surgery or get care for minor illnesses. Now, patients can have surgery and go home the same day. They can also get treatment for illnesses and go home without having to make arrangements to stay overnight in the hospital. Long-term care facilities have addressed inequity by striving to provide patient-centered care to make the patient adjust easier to living in a group environment when it is no longer safe to live alone at home. This has made the transition easier for most patients. Emergency care, part of the outpatient care center, has addressed inequities by providing interpreters for patients with language barriers. There are also case managers available at most ERs to assist with providing patient-centered care and assist with resources the patient may need. LeBrun and colleagues describe health centers as centers that are strategically placed in rural areas to assist underserved populations with access to care. This addresses inequities by having services available close to home so patients do not have to travel to get information, health information, and education about diseases and illnesses. Who are the purchasers? The purchasers are individuals, insurance companies, employer or self-employed, and government finance programs like Medicare and Medicaid. How do they work? Individuals purchase health insurance either through employment or private pay, apply for government-funded plans, or pay cash out of pocket for health care. Insurance companies compete to sell health insurance policies to individuals either through employment plans or private pay. Government-funded plans or Medicare and Medicaid plans. Individuals have to apply for these programs and have to meet qualifications to be allowed to have these plans. NURN and colleagues did a study to see what influences purchasers when managing a chronic condition. They identified care chains that linked the care of multiple providers, all attempting to manage chronic conditions. Policymakers require purchasers to provide care to care chains when caring for patients with complex needs and attempt to decrease the cost of healthcare spending. Purchasers are also expected to widen access to care for these complex patients while also providing improved outcomes. How do purchasers create or address inequity in healthcare access? Insurance policies are pricey, and there is a large population who cannot afford to pay for health insurance. There are many policies with different coverage options. This can be confusing to most individuals when deciding how much or which care is needed to help cover their health issues, both acute and chronic. If a person cannot afford proper coverage, he or she will not be able to manage the chronic conditions due to cost. Government-funded programs should fill in the gap for the underinsured or uninsured populations. Unfortunately, many people fall in the cracks between the two providers. Those people are not able to manage chronic diseases and have poor health outcomes. In conclusion, healthcare delivery in the United States is complicated and expensive. Many Americans cannot afford proper health insurance and do not qualify for government-funded health care. Those people cannot manage their chronic health conditions and have poor outcomes. Many poor and elderly people must choose between buying medications or buying food.